So good morning, everyone. Thank you for coming. As I mentioned to you earlier, so I've been conducting a survey to see what kind of the topic that would be of interest to you. And so interestingly, mental health and depression was #1 topic. So I prepared a little presentation for you guys today.
Thank you.
So let's begin. So depression is a very interesting topic, right? So when I was preparing myself for that, and I was thinking, okay, how is it better presented? And interestingly, there's a lot of, so depression is one of the most common psychiatric disorders in worldwide. And surprisingly, in the US, it's actually 20% of people will suffer from depression in their lifetime. As I was mentioning, so depression is most common psychiatric disorder worldwide, and 20% of people in the US will experience depression at some point in their life. And interestingly, 7 million Americans, adults over the age of 65, will experience depression each year. But unfortunately, not many people report signs and symptoms and don't talk about depressions with their healthcare providers or with their loved ones. And one of the reasons is a big stigma that surrounds depression and mental health in general. And many people perceive it as a weakness, a character flaw. It could be something that people don't think that is a real illness. But so what is depression? So depression is a medical condition, just like diabetes, just like heart disease. Like diabetes affects your blood glucose levels, or your heart affects your pulse. In the same way, depression affects the way you feel, the way you think, and the way you behave. Very often people think of depression as sadness or grief. So there are many situations in life where people experience grief because of the death of loved ones. It could be loss of a job, or it could be something like the end of a relationship. But being sad and being depressed is not the same thing. And in this sense, so for example, depression, so the grief usually does not come with loss of self-esteem, but with depression is very often people will feel the feeling of worthlessness. Some of the causes for depression is biological. So many people don't know that it's actually a chemical imbalance that causes depression. So there are molecules, chemicals that send signals from one brain cell to another. And with depression, there's imbalance in that process. Another cause is genetic. So depression actually runs in families. And research shows that if one identical twin had a depression, then the second identical twin will actually have a 70% chance of developing depression in their life. So it is genetic. Another factor and a cause is environmental. So there's many factors such as violence, it could be neglect or poverty that affects people, and also it could be something like triggers of some events, life events that could trigger it. It could be researcher shows that for older adults, it could be either death of loved ones, it could be worries about health, or worries about a financial situation. How can we know that it's depression? So there are several signs and symptoms. One of them is feeling sad and having depressed mood, which usually lasts longer than 2 weeks, right? Consequently. So it's not like one day I'm feeling sad, and then then you cannot conclude that you're depressed, right? It's also loss of interest or pleasure in activities that once enjoyed. So let's say if you like to walk, and you always walk your entire life, but then at some point you no longer enjoy it. You don't want to get out of the house, and then you just don't feel pleasure in that anymore. So that could be one of that as well. Changes in appetite. So that could be either overeating or not having enough appetite and not eating enough. Trouble sleeping. As I mentioned, that it actually could affect depression, people who are depressed quite drastically, because people could either sleep for long periods of time, more than usual, or they could not have enough sleep and, twist and turn in bed and thinking about things, right? Some other signs and symptoms, as I mentioned earlier, feeling of worthless or guilt. Many people who are depressed feel guilty about those feelings, and it's not necessarily that you have, like, people think, I don't really have anything to be ungrateful for. Why am I feeling that way? So they feel that guilt. So it's very common. There's also difficulty thinking and concentrating and making even little decisions. Very small decisions become a big task. Loss of energy, and last but not least, people could develop thoughts of suicide and death. Right? So, but I guess the good news with depression is treatable, and it actually shows that 80 to 90% of people will get cured from depression, and almost everyone will get reliefs of signs. So it is treatable. So there's no way to be depressed and not get treated, right? So some of the treatment options are medications. As I mentioned, there's a chemical imbalance, and then we have different classes of antidepressant medications that help to fix that imbalance. But one thing that we should remember about medications, that it actually takes few weeks to show effect. So you should not expect improvement of the symptoms right away. And another treatment is psychotherapy. So it's a talk therapy. It could be with your social worker, with your healthcare provider, with a psychologist, or a nurse who is specialized in mental health issues. Another one is combination of both, and very often we see that in practice when people take certain medications and they go to therapy to help it out. And the therapy, it's almost like exercise for your brain, which psychologists will help you to understand why you're having those feelings and work on them. So I wanted to talk about other ways to help yourself, so except for medications and doctors, right? So one of the most important things is diet, right? So it's very important to have a healthy diet, not to reserve yourself to junk food, but to just have healthier snacks instead. And another thing is actually alcohol. So alcohol is known as a depressant, and if you could cut it back or avoid alcohol, then it's actually helpful. Another thing is exercise. Staying active really helps. I know that for many people who are depressed, it actually could be a very big challenge to go out. So one of the things I would suggest is to maybe have someone, like a friend, right, who you could go out with, and that make that commitment. So you go and go for a walk. It could be, come here and do exercises that is provided here too. Sleep is also very important. It's very important to get a quality sleep and have a special schedule. So it's very good actually to wake up around the same time and go to bed around the same time, and sleep in the bed instead of, let's say, on a couch, in front of TV, or maybe on a recliner chair. So it's nice to actually go and sleep in the bed. Another good one is to socialize, and I'm very happy that you guys always come here, and this is actually, you know, you don't realize, but you do so much, you know, there's so much benefit in socializing to share your thoughts and feelings, just like in this current event class, which I think is really good to ward off the depression. Another way is to relax. It could be either breathing exercises, it could be yoga, it could be Tai Chi, it could be meditation. There's actually a couple of classes that do exercises, right? Then also, I know that every Friday, so at least the 7th, this Friday, the 7th and 14th, the next Friday, will be a meditation class. I don't know if you guys know, but it's by Mary Lynn, and it's usually from 10:30 to 11:30.
She's very good.
If you could come to that session, it would be also helpful. Then another thing is journaling, actually. The study shows that a gratitude journal could do wonders and even help with things not related to mental health but also physical health. It's very important to, you know, sit down maybe in the morning and then just spend maybe 5 minutes or even less just to write down something that you're thankful for this day. So it's a very easy but a very useful tool. And again, so if you feel that you need to get help, so you always should contact professionals.
So how do you, excuse me, how do you do that about getting a professional? Is there a title that they have that you look up, or how does it?
So I will answer all the questions
Okay,
at the
fair
end.
enough.
Yeah, okay. But it's a good question. I'll address this. Then also I want to talk about not just ways to help yourself, but also help others. Because we probably all know someone who might be depressed, and it's always good to reach out and first of all encourage them to do some activities that they enjoy and do something together. Another thing is not to minimize their feelings, because a lot of cases some people don't understand that it's actually medical condition that causes such sadness. And many people think that, you know, this person does not have any problems. The life is going really well for them, and but it's really important to not minimize or reject those feelings and support your loved ones and friends. And another thing is to avoid cliches such as, you know, everything's going to be all right, or, you know, things could be worse, because this is actually not very helpful.